In the previous video, we talked about different parameters that influence the glomerular filtration rate, which means any modifications in these factors will also alter the GFR. Now let's talk about how the afferent and efferent arterioles they can modulate the glomerular hydrostatic pressure in order to bring about the changes in GFR. Now the glomerular capillaries they are flanked between the afferent and efferent arterioles. And these arterioles, they are the main resistive elements within this renal vasculature. And as we know that in order to overcome the resistance, whenever the resistance increase, the pressure is lost by overcoming this resistance. The blood that enters the kidneys from the renal arteries, it has a relatively high hydrostatic pressure of approximately 110 millimeter of mercury. Now that blood then passes sequentially through the afferent arteriole, glomerulus and the efferent arterioles before returning to the renal vein. Now by then the blood pressure has dropped to a relatively low pressure by approximately 10 millimeter of mercury. This 10 millimeter of mercury, it represents that an overall pressure drop of 100 millimeter of mercury between the blood on the arterial side of the circulation compared to the blood on the venous side of the circulation. Now, how that pressure drop is distributed across the afferent and efferent arterioles, it determines what the hydrostatic pressure in the glomerulus will be, which will ultimately determine the GFR. This graph represents the landscape of blood pressures within the different vascular segments within the kidneys. Now, note that the blood pressure of the blood that enters the kidneys via the renal artery is the relatively high blood pressure of 110 millimeter of mercury. This blood then ultimately distributes down to afferent arterioles, which is the first resistive element in the renal vascular series. Now, because the afferent arterioles are one of the main resistive elements, the blood pressure drops as it moves through the afferent arteriole, and this blood then reaches the glomerulus, which has a relatively low vascular resistance. That is why there is little to no pressure drop that occurs as the blood is moving through the glomerulus. So we could expect the first pressure drop to be around 50 millimeter of mercury. After the pressure drop on the afferent arterioles, we could expect that the glomerular hydrostatic pressure to be 60 millimeter of mercury. The blood that remains unfiltered then moves to the afferent arteriole, which is the second main resistive element. Now, once again, the blood pressure drops as it is moving through this resistive element. And we can estimate this pressure drop to be around 50 millimeter of mercury. Now, based on these values, we would then expect that the hydrostatic pressure of blood to be approximately 10 millimeter of mercury by the time it reaches to the peritubular capillaries and renal vein. So an important consequence of this pressure drop is the resulting hydrostatic pressure within the glomerulus that actually determines the net filtration pressure and ultimately the GFR, because the GFR is the product of net filtration pressure and the filtration coefficient. And now changes to this hydrostatic pressure, either increasing it or decreasing it, it produces the corresponding changes in the net filtration pressure and ultimately the GFR. So changes in the resistance of afferent and efferent arterioles can change the distribution of this pressure drops, which will have a consequence that the hydrostatic pressure of the glomerulus will be changed. Now, for the first set of scenarios, let's consider that the afferent arteriole has now a higher resistance than the efferent arteriole, which can be accomplished either through the vasoconstriction of the afferent arteriole, which will increase its resistance, or likewise this can also be brought about by the vasodilation of efferent arteriole, which will decrease the resistance of efferent arteriole. And in either case, the resistance of afferent arteriole is made to be larger than the resistance of efferent arteriole. Now, as the blood is moving through the afferent arteriole, it will experience a larger pressure drop. So, comparing it to the original condition where we had equal resistances, if the afferent arteriole has higher resistance, we could expect that the blood entering from the renal artery will experience a larger pressure drop as it's making its way through the afferent arteriole. And the consequence of this is that now the glomerular hydrostatic pressure will be lower than the normal. And based on these values, we estimate it to be approximately 35 mm of mercury. The blood then leaves the glomerulus, enters the efferent arteriole, and experiences a second pressure drop, and which happens to be a relatively smaller, again because it has a smaller resistance as compared to the resistance in the efferent arteriole. So the consequence of these changes, where the resistance of the efferent arteriole is made to be larger than the efferent, is that a decrease in the glomerular hydrostatic pressure, which will tend to produce a reduction in the net filtration pressure and ultimately the GFR. Now let's consider the second set of conditions such that now the resistance of the efferent arteriole is made to be greater than the resistance of the efferent arteriole. And this can be accomplished by either the vasodilation of the efferent arteriole, thus decreasing its resistance, or the vasoconstriction of the efferent arteriole and increasing its resistance. And again, in either case, the resistance of the efferent arteriole is made to be greater than the resistance of the efferent arteriole. This means now the blood entering the efferent arteriole from the renal artery will experience a relatively small pressure drop when this occurs. Now the hydrostatic pressure will tend to be higher than the normal. In this case, it will be 75 mm of mercury. The blood then leaving the glomerulus and entering the efferent arteriole will now experience a larger pressure drop again due to the relatively high resistance of efferent arteriole. And the overall consequence is that now there will be an increase in the glomerular hydrostatic pressure. And this would tend to increase the net filtration pressure, ultimately resulting in an increase in the glomerular filtration rate. So there we have two set of changes in efferent and efferent arteriole resistances that bring about two different outcomes, either an increase or decrease in the glomerular hydrostatic pressure, resulting in an increase or decrease in the GFR respectively. So the GFR is therefore strongly dependent on the relative resistances of both efferent and efferent arterioles, and which is influenced by sympathetic tone and also other vasoactive agents. So changes in the glomerular hydrostatic pressure is probably the single most important mechanism for modulating the glomerular filtration rate. But it is not the only mechanism by which the GFR can be affected. There are other parameters that can be modulated to bring about changes in the GFR, which include the hydrostatic pressure within the Bowman's capsule. So whenever there is an increase in the hydrostatic pressure of the Bowman's capsule, the net filtration pressure will decrease and causing an ultimate decrease in the glomerular filtration rate. And it usually occurs in the conditions such as urinary tract obstruction, for example, kidney stones, in which the pressure in the Bowman's capsule will be increased, causing an ultimate increase in the glomerular filtration rate. The next factor is the oncotic pressure within the glomerulus. So whenever there is an increase in the colloid osmotic pressure in the glomerulus, which means there are now increased plasma proteins, the net filtration pressure will be decreased and ultimately causing a decrease in the glomerular filtration rate. So these are the main important factors that can be modulated to bring about changes in the GFR. This was all about the renal filtration. In our next video, we'll discuss about the concept of renal clearance.
Watch our medical videos anytime and anywhere. Download sqadia.com app now.